Most people taking hair vitamins are taking the wrong one. The supplement that almost everyone buys for hair loss is not actually the most important vitamin for hair growth. In fact, there is another vitamin that many hair loss patients are deficient in, and fixing that deficiency can make a much bigger difference. Today, I'll explain 3 supplements that actually have scientific evidence for hair health, how they work, and who should really be taking them. Hi everyone, I'm Dr. Ko, a hair transplant surgeon in Korea. One of the most common questions I hear from patients is this: Doctor, what vitamins should I take for my hair? If you search online, you'll see hundreds of products claiming they can stop hair loss or regrow hair, but the truth is much simpler. There are only a few supplements that actually have reasonable scientific evidence behind them. And today we'll talk about the 3 most important ones. Let's start with the one that surprises most people. Vitamin D. Most people think of vitamin D for bone health or the immune system, but it turns out that vitamin D is also very important for hair follicles. Hair follicles actually have something called vitamin D receptors. These receptors help regulate the hair growth cycle. Hair does not grow continuously forever. Instead, each hair follicle cycles through 3 stages: growth phase, transition phase, and resting phase. Vitamin D helps the follicle properly enter the growth phase, also known as the anagen phase. If vitamin D levels are too low, this cycle may not work properly, and several studies have found something interesting. People with certain types of hair loss often have lower vitamin D levels compared to people without hair loss. This does not mean vitamin D alone will regrow hair, but correcting a deficiency may help create a healthier environment for hair follicles. The second supplement is omega-3 fatty acids. Omega-3 is widely known for heart health, but it may also play a role in hair health. There are 2 main reasons for this. First, omega-3 help reduce inflammation in the body. Chronic inflammation can negatively affect many tissues, including hair follicles. By lowering inflammatory signals, omega-3 may help create a better environment for healthy hair growth. Second, omega-3 may improve blood circulation. Hair follicles rely on tiny blood vessels to deliver oxygen and nutrients. Better circulation means follicles can receive the resources they need to produce stronger hair. Some studies have shown that people taking omega-3 supplements experienced increased hair density and reduced hair shedding over several months. However, dosage is important. Most people do well with around 1,000 to 2,000 milligrams per day. Very high doses, usually above 3,000 milligrams daily, may increase bleeding risk, especially for people taking blood thinning medications. So moderation is important. Now let's talk about the supplement that almost everyone already knows: biotin. Biotin is often called the hair vitamin, and it does play a role in hair biology. Biotin helps the body produce keratin, which is the main protein that makes up hair. So you can think of biotin as a building material for hair. But here is the important point. Biotin is most helpful when someone is actually deficient, and true biotin deficiency is not very common. However, it can happen in certain situations. For example, extreme dieting, gastrointestinal disorders, long-term antibiotic use, or certain metabolic conditions. In those cases, biotin supplementation can make a noticeable difference. So, how should someone approach hair supplements? Instead of taking everything at once, I usually suggest a simple strategy. First, check your vitamin D level because deficiency is quite common. Second, consider supplements that support overall health, like omega-3 fatty acids. Third, use biotin mainly if there is a possible deficiency or increased need. And remember something very important. Hair loss supplements are not a replacement for medical treatment. Medications like finasteride or dutasteride target the hormonal cause of hair loss. Supplements play a different role. They help support the overall health of the hair follicle. So think of it this way. Medications treat the root cause. Supplements improve the environment where hair grows. And when both are optimized, patients often see much better result. I'm Dr. Ko. Subscribe if you want evidence-based knowledge to protect your hair before it's too late. And I will see you in the next video.